Bore da I bob un ohonoch chi a chroeso cynnes iawn I gyfarfod y bwrdd heddiw. Ac fel y gwelwch chi, mae'r cyfarfod yn cael ei ffrydio'n fyw drwy wefan ein bwrdd iechyd. Ac yn ôl ein harfer, bydd recordiad o'r cyfarfod hefyd ar gael i'w wylio ar-lein yn dilyn y digwyddiad heddiw. Carl Cooper ydy yn enwi a fi ydy cadeirydd y bwrdd iechyd addysgu Powys. It's a great pleasure this morning to welcome each and every one of you to today's meeting of our board. And as always, the meeting is being live streamed via our Health Board's website. A recording of the meeting will be available to watch after the event today. And by way of introduction, my name is Carl Cooper and I am the chair of the board of Powys Teaching Health Board. Ac yn y man, fe welwch chi ar y sgrin enwau a manylion aelodau y bwrdd, yn ogystal â'r bobl fydd yn mynychu, hynny yw, mynychwyr ychwanegol fydd gyda ni yn ystod y cyfarfod a fydd yn cyfrannu at wahanol eitemau o'r agenda wrth I ni fynd trwy y cyfarfod heddiw. Ac hefyd ar y sgrin, fe welwch chi enwau cydweithwyr sy'n methu bod gyda ni heddiw a dyn ni wedi derbyn eu hymddiheuriadau am absenoldeb. You'll see just in a second or two on the screen the names and details of all board members, as well as additional people, additional attendees that will be joining us during our meeting to contribute to different agenda items. Also on the screen, you will see that we do have some colleagues today who, for various reasons, can't be with us and whose apologies for absence we have accepted. Ond be di'n pwrpas ni? Hynny yw, be di ein rôl ni fel bwrdd? Wel, ni ydy corff llywodraethol y bwrdd iechyd. Ac mae'r bwrdd yn cynnwys aelodau annibynnol yn ogystal ag aelodau gweithredol a chyda'n gilydd dyn ni'n ffurfio bwrdd unedol. Ac ein cyfrifoldeb ni, mae yna 4 prif cyfrifoldeb os liciech chi. Yn gyntaf, dyn ni yma I osod cyfeiriad strategol ar gyfer ein sefydliad. Yn ail, dyn ni yma I osod yr awydd I fentro wrth gyflawni ein hamcanion strategol. Yn drydydd, dyn ni yma I fonitro cyflawniad a pherfformiad yn erbyn yr amcanion strategol hynny. Ac yn bedwerydd, ac yn sicr nid y lleia, oherwydd mae'n holl bwysig, dyn ni yma I osod naws a diwylliant ac ar draws y sefydliad. Our purpose and our responsibility as a board is fourfold. And as a board, we are comprised of both independent members and of executive members. But first, we're here to set the strategic direction for our organisation. Second, we're here to set the risk appetite against that strategic direction and our strategic aims. Thirdly, we're here to monitor delivery and performance against those agreed strategic aims. And fourthly, but certainly not least, because it is hugely important, we're here to set and to shape and to model the tone and the culture of our organisation. Now, we meet in public in line with NHS Wales regulations, but it's probably helpful to explain that although we meet in public, this isn't a public meeting. So the only people that will be contributing to our meeting this morning are members of the board and those invited attendees. However, we always welcome questions and feedback from the public at our board meetings. And please have a look at our website where you will find information on how to submit questions for our consideration during our public board meetings. Ac fel y gwelwch chi hefyd yn ein hagenda, mae gennym ni fel bwrdd beth y gelwir yn agenda gyd-syniad. A hynny yw agenda lle byddwn ni'n yn derbyn yr eitemau fel rhai sydd wedi eu cymeradwyo ac wedi derbyn heb gorfod i trafod nhw yn ystod y cyfarfod. Yn ystod y cyfarfod heddiw, mi fyddwn ni yn cymryd seibiannau ac mi fyddwn ni yn cymryd egwyl cinio o ddeiti 1 o'r gloch, ynde. So just again, by way of explanation, we operate a consent agenda as part of our board agenda. These are items that are considered not contentious and therefore that don't need discussion per se during our meeting. However, they may well need decisions. We may need to approve them or accept them or note them and so on. So when we come to that bit of the agenda, we will accept or we will deal with all of those items en bloc. However, as you will see, there is always an opportunity for any member of our board to suggest and request that items be lifted from the consent agenda and be placed as a substantive item on our agenda for today. So we have a packed agenda as always. We will take breaks during our meeting, and we will also take a half-hour lunch break at around about 1 o'clock. Ac felly, heb oedi dim mwy, dwi am symud at yr agenda, ac fe welwch chi yr agenda ar y papurau, maen nhw ar gael o'n gwefan ni. The agenda and the papers for today's meeting are all published on our website, so please do look at them and access them there. But without any further ado, we're going to move now to the agenda and to item 1.2 on our agenda, where I invite colleagues to declare any interest associated with any item on our agenda today. We do, of course, keep a register of interests. So colleagues, does anyone want to declare an interest that isn't already declared on the register in relation to any item on our agenda today? No one is indicating, so there are no additional declarations of interest. We turn now to item 1.3 on our agenda and the board action log, and I will ask our Director of Corporate Governance and Board Secretary, Helen Bushell, just to comment on the action log. Please, Helen.
Bore da. Thank you, Carl. Good morning, everybody. I'm Helen Bushell, Director of Corporate Governance and Board Secretary. As everyone can see from the board pack, the action log has been updated for your awareness. There is one risk that continues to be at risk. What that means is it's not been delivered to the original timescale. The board agreed a change of timescale to March. We're now seeking that to be September. That's in relation to an item, the People's Experience Framework. That's being closely monitored and discussed within our Patient Experience, Quality and Safety Committee. We've been awaiting some national release of that framework. That's now happened within the space of the last month, and that's now being rapidly worked on by Claire and her team. So not a Powys originated delay, Carl, but something that we do need to keep track of and we'll bring back to the board at the earliest opportunity. In terms of the actions recommended for closure then, there are 5 of those. 2 of them are completed. As noted, 3 of them have been transferred to the relevant committees and they will also be tracked through our action logs and work programmes. But very happy to take any questions. Thank you.
Thank you, Helen. Does anyone want to comment or ask a question in relation to the action log? No, so thank you very much for that. And we move to 1.4 on our agenda, where at this point we receive we call it a patient story or a staff story. In other words, someone that describes their experience of working in Powys Teaching Health Board or being a patient receiving services in Powys Teaching Health Board. And I'm going to invite Claire Madsen, our Executive Director of Allied Health Professions, Health Science and Digital, who will also introduce one of her colleagues and the story draws our attention to radiography. Thank you, Claire.
Thank you, Chair. Morning, everybody. As Carl says, I'm Claire Madsen, Executive Director of AHP's Healthcare Sciences and Digital. I'm really delighted this morning to introduce one of my colleagues, Michelle Kirkham. She's our Professional Head of Radiography, and she's going to take us through the exciting journey that we've recently experienced of implementing our capital equipment replacement programme, which has given us a lot of new exciting kit in Powys. So I won't just take her thunder, and I'll let her talk you through all the exciting new equipment that we've had. So welcome, Michelle. Thank you.
Thank you, Claire. Bore da. Good morning, everyone. As Claire said, my name is Michelle Kirkham, and I'm the Professional Head of Radiography. I'd like to thank you for this opportunity to speak with you today. I'm really looking forward to sharing this radiology success story, and I hope you'll come away feeling just as excited about the future of diagnostics in Powys as I am. So let's start with the overview of service provision across Powys. So Powys has 6 radiology departments across Powys, consisting of general X-ray and ultrasound. The X-ray service supports minor injuries for rapid imaging of minor trauma and fractures, etc. It supports orthopedics for joint dislocations and degenerative bone diseases. It supports surgery with pre-op imaging for assessment of anatomical structures. Radiology supports internal medicine for chest x-rays for pneumonia, for example. It supports cardiology with chest x-rays to assess heart size. It supports oncology for monitoring tumour progression, and supports general practice and outpatient clinics, diagnosing MSK issues and respiratory conditions. The ultrasound service supports obstetrics, gynecology, MSK and cardiology. So as you can imagine, we have some quite busy departments, with general X-ray performing over 22.5 examinations and ultrasound over 6,500 examinations in 23-24 alone. So I wanted to give you a brief overview to describe how we arrived at replacing the equipment, and it all really stemmed from the Radiology Informatics System Procurement, or RISP programme. And this was a national programme across Wales and was started in 2019. It's currently managed by DHCW. Its goal is to create a fully connected system for managing radiology services. So basically all the images across Wales will be stored on one system, which is the PACS, and all the patient data, dose information, etc. will be stored on another system, which is a RIS, or Radiology Information System, meaning that if you had an X-ray in Cardiff and Vale but moved to Newtown, the Newtown team would be able to view your images seamlessly, whereas currently we would request them from the neighbouring health board, have to wait for them to be sent, they'd go into quarantine, and that would take time before they were finally viewed. So the rationale behind the change was because of the RISK programme means that our current PACS and RIS systems, which we share with the neighbouring health boards, when the RIS programme goes live, these will be switched off. Once these health boards switch to the new system, we wouldn't be able to store any images, and our existing X-ray equipment wouldn't be compatible with the new setup. So Powys needed a plan. So we wrote a business case detailing the situation and presented this to Welsh Government. And in June 24, we were notified that we had been awarded £1.7 million from Welsh Government to complete the capital replacement programme, with the caveat that it all needed to be installed by March 25. So this felt like quite a big challenge, but it turned out to be an absolutely fantastic opportunity. It meant that Powys could finally have its own system and upgrade all our existing outdated computerized radiography equipment to the modern digital equipment. Digital equipment has a lower dose, it's faster patient examination times, the images are available quicker for reporting, and it supports staff development, recruitment and retention. And this aligns really nicely with the Health Board's strategic objectives of safety, efficiency, patient experience and staff support. So the scope of the programme was to replace the outdated CR equipment with digital equipment for general X-ray and dental, including an OPG dental X-ray machine in Llandrindod. With that, we needed to improve infrastructure and the completion of enabling works for the installation of the upgrade to the radiographic systems. And all of this, of course, as the X-ray equipment was affected, the ultrasound service needed to remain operational. So this was given special consideration in the planning phase, as the contractors needed to be mindful that normal operational activity for ultrasound had to continue with minimal disruption in terms of noise, dust, construction materials, etc. And all of this involved meticulous planning from colleagues from finance, digital, IG, communications, estates, procurement, and the executive team. So if we look at the process and the timeline, so as I mentioned, we were notified in June 24 and had been awarded 1.7 million from Welsh Government. This included the purchase of the equipment, the completion of the enabling works, and the VAT, with the teeny tiny caveat that it all had to be completed by March 25. So PTHB had now got two significant programmes running simultaneously, the RISP programme and now the Capital Replacement programme. With the two programmes running concurrently, it was necessary to establish a governance structure capable of overseeing both. Given their intrinsic link, we decided to implement a single programme board structured into two distinct work streams, one focused on RISP and the other on capital. The board convened on a monthly basis with separate weekly meetings held for RISP and the capital elements, and this was to ensure effective oversight and coordination. The key personnel involved in the capital elements were the executive directors, procurement, finance, estates, communications team, IG, digital, and of course radiology. Medical physics teams were also involved and consulted on radiation protection features during the planning stage and later during the commissioning and completion of the critical examination certificates. Firstly, we established the governance structure consisting of the board and the project oversight groups. We then met with the procurement to discuss the digital equipment, and when we were looking at the digital equipment, there are quite a few important things that you need to think about. We needed something that delivered high quality images, was easy for the staff to use, and could handle a busy workload, including more complex cases like trauma or bariatric patients. It also had to integrate smoothly with our new systems. Things like dose management, software functionality, and overall ease of use were really important too, not just for patient care, but for also efficiency in the department and for staff morale. And on top of that, we were working to a really tight timescale. So one of the key factors was to make sure the supplier could guarantee delivery and installation within that short window. This meant looking closely at the vendor's track record, availability of support, and how reliable their service and maintenance offering was. We also had to think about cost, future-proofing, and how well the equipment would fit in with our current space. So it was a balance between finding the right clinical solution and making sure we had the assurance it would be delivered on time with the minimal disruption. Working closely with procurement, we were recommended the Samsung Vision Plus DR X-ray equipment, and myself and the team lead radiographer went to Hywel Dda, Aberystwyth Hospital to view the equipment in situ and speak to the staff to get their views. It was impressive. It was robust with excellent functionality, usability. It was future-proof with excellent reports of post-installation support from the applications team to train the staff. And we were satisfied this would be an excellent choice for Powys and started the procurement process with NWSSP. Running parallel with decisions on the new equipment, the team also had to agree on the replacement and department closure plan. This was crucial. We needed to make sure that we continued offering X-ray services across Powys to support essential services like MIU and keep the ultrasound clinics running, since those were staying open. We had to think about the full timeline, aiming to give everything completed by March 25. And this meant factoring in the lead time for ordering the new equipment, planning staff training, arranging the removal of the old machines, and we had to schedule any necessary remedial works before the new equipment could be installed. When the newer machines were in place, the medical physics teams would commission the new equipment to make sure everything was safe and ready to go. And finally, we needed to train the staff on how to use them. Because of its very tight timescales, we decided the best approach would be to close 2 departments at a time and carry out the work in 2 phases, working on 2 rooms simultaneously. A key factor which departments to close first was the impact on patients. We needed to minimise the disruption as much as possible. So phase 1 of the new equipment installation began on the 12th of November 24, starting with Ystrad Lais, Lllandrindod and Welsh Ball. Working closely alongside the communications teams, we sent regular updates to GPs, we had social media posts, and PTHB updates were sent to all the remaining stakeholders. And you can see on this slide here all the sites at Welsh Ball, Lllandrindod and Ystrad Lais. It was a major refurb. It was ripping out right back, pulling up the floors, removing ceilings, sometimes going back to the external wall just so that we could fit the cables, etc. So it was a major replacement exercise. Replacing the X-ray equipment at each site would take approximately 8 weeks, and during this time, patients were offered an appointment at another community hospital within Powys, so Brecon Memorial and Montgomery County Infirmary. Once the first phase is completed, phase 2 of the equipment replacement began in January, and we started work on Brecon and Newtown. So now I wanted to show you the grand reveal and show you the beautiful rooms that these transformed into. And here we've got Lllandrindod, Welsh Ball and Ystrad Lais, and a member of my team there. They were all delighted with the new equipment. And if we just move on to the next one, and here we have Newtown and Brecon. The team were consulted about the equipment and also about the decoration, as they are the ones going to be working with it all the time, so it's important to get their views. This was completed from start to finish in November 24 to the 24th of March 25, so we completed it on time. So if we look at the benefits of the new equipment, I want to talk to you about image quality. So here we've got 2 images. The image on the right is the image of a lumbar spine produced by digital equipment, and the image on the right is produced by our CR equipment that we used to have. So really, it's really quite evident. Seeing is believing. Beyond the speed, the new DR equipment delivers a noticeable leap in quality compared to our outdated CR equipment. While CR provided diagnostically acceptable images, the DR systems, especially premium ones like the Samsung Vision Plus, use advanced flat panel detectors and sophisticated post-processing algorithms. This means we're getting images with superior spatial resolution, better contrast differentiation, and significantly less noise, electronic noise. And this improved clarity allows for more confident diagnosis and the ability to discern subtle details that might have been less clear on CR. I also want to talk to you about radiation dose. So patient safety is paramount, and a significant advantage of moving to a Samsung DR system is its capability for dose reduction. While both CR and DR systems adhere to safety standards, modern DR technology combined with advanced image processing produce high quality images with potentially lower X-ray doses for the patient. And this isn't just about meeting compliance, it's about continuously striving to use the lowest possible radiation exposure while maintaining diagnostic image quality. And this is adhering to the as low as reasonably practical principle. I want to talk to you about speed and workflow, and this was an immediate game changer. So one of the most immediate impactful changes we've noticed with the Samsung DR is the drastic improvement in speed and workflow. With our previous Shimadzu CR, every X-ray image required multiple manual steps. The X-ray was taken, the image plate was then manually transported to a CR reader, scanned, and finally the image appeared on the screen. And the entire process introduced delays and bottlenecks, particularly during busy periods. The Samsung DR system fundamentally changes this by capturing the image directly onto a digital detector. There's no physical image plate to handle or scan, and the moment the X-ray exposure is complete, the image is almost simultaneously available for review on the acquisition console. So the image processing time has reduced by 99.33%, or to put it another way, is now 150 times faster. And we also have the potential to double our capacity from 20 patients a day to 40, and that's a potential increase of 100%. Other advanced features include image processing to produce clearer images, and this equipment is compatible with the AI software. This works by producing a duplicate image and scanning it for abnormalities before highlighting them to the operator. And you can see the image on the right there just has a little indication there where the AI software picks up something which it thinks could possibly be an abnormality. This therefore enables the radiographer to expedite the images for reporting where necessary and improve the patient pathway. And it will come as no surprise to you all that I'm particularly keen to purchase the Chest AI package, and have actually applied to charitable funds for this. So looking forward to the outcome of that. So there was a second wave of capital purchase, and this was due to the unexpected slippage money. So my financial colleagues playfully accused me of having the Midas touch, and I like to think of it more of being a bit tenacious. So in addition to the 1.7 million that we received from Welsh Government for the capital replacement of equipment relating to the RISP programme, we were also extremely fortunate to secure additional funding through the slippage money at the end of the financial year, and this enabled the radiology department to purchase and replace 2 ultrasound scanners, one for Llandrindod and one for Ystrad, 5 decontamination units for the 5 ultrasound rooms used to decontaminate the ultrasound probes, and last but by no means least, we were extremely fortunate to replace a condemned dental X-ray machine with the state-of-the-art cone beam computerized tomography dental machine. Very briefly, a CBCT, cone beam CT scanner, is a 3D X-ray imaging used mainly in dentistry, ear, nose and throat, and some orthopedic applications, for example, scaphoid. It provides detailed images of bone and soft tissue with a lower radiation dose than traditional CT. It's commonly used for dental implants, assessing tooth roots, jaw structure and sinuses, as well as evaluating TMJ disorders and ear or sinus conditions in ENT. CBCT is quick, efficient, and often used in outpatients or dental settings due to its compact size and low dose. So previously, Powys patients would have to travel down to Cardiff for the examination, and that has been approximately 400 patients per year, and now they can have it done in Newtown. So that's a fantastic development for Powys. So if we have a look at patient experience, we asked 107 patients to complete a patient experience survey, and the key themes were evident. And I've done a little word cloud here for you for a visual display, but the key themes were that it was efficient, it was clean, quick, relaxed, modern and professional, reflecting a consistently positive patient experience. We also had a visit from Kirsty Williams, who stopped a patient in the corridor and asked them what they thought of the new facilities. The patient replied that he loved this hospital, almost wished he could be ill more often and could come more frequently. He said he'd moved from the south of England and was so pleased to have this hospital on his doorstep where he could call and speak to somebody, and was pleased to see investment in the locality. So that's some really great patient experience that we received, and it's always great for staff morale. So looking at staff experience, all the radiography staff, including radiographers, healthcare support workers, the PACS manager, sonographers, and the reporting radiographer, were asked to complete a questionnaire. They were asked if they'd received any feedback from the patients, and this boosts morale and gives you a nice sense of pride when you clearly see patients are impressed. So the patients were really happy with the new equipment. They stated how much faster it was and how nice it looks. One of the staff heard a little boy say to his mum that it looked like a spaceship. Patients were saying that it looked good, it was quicker, and they're glad the money was being spent locally on top of the range equipment. Patients loved the speed, The patients think it's great, very state of the art, and they're really pleased that this project was supported and the new equipment installed. We asked the staff what they thought about the motorised functionality, and they said that they were experiencing much less physical stress on their back. They were having less pain in their feet and their knees. It was having a positive impact. They were definitely receiving less strain and no longer dragging the clunky tube around. And as the tube is automatic and it moves into position, all you need to do is very fine minor adjustments. They were also asked whether they had thought it had any impact on the department. They thought it made it feel that the department's valued. Most patients pass through the radiology department in their diagnostic pathway, and they felt that the patients that this work was done not only for patients but also to benefit the radiology department to run faster and smoother. The staff think that the equipment is fantastic, much quicker service is provided, and the improved image quality. And they have a lot less stress physically on moving the equipment. And there's another word cloud there, just a few comments. They're less tired, they've got less neck pain, they love the improvement. We had great support from MIS, and they're less tired. So we also asked the staff if they thought it would have any impact on recruitment and retention. They said that the new equipment would be attractive for prospective hires, and for current staff it will help ease workloads. They're more likely to want to come and work in areas with modern equipment like the DR, and the latest kit does help with recruitment and potential reduction of MSK issues with the automated movements, so should help with retention. So we also asked them how they would rate the new equipment overall, and we got 4.5 out of 5 for that. So I was very pleased with that. They're very happy with the new equipment. They think it's very good. Automove has made handling the equipment easier as they no longer have to process cassettes and can see patients quicker. The new equipment is top of the range and very useful in making imaging quicker and much more diagnostic in terms of image quality. And one of the members of staff said, in my opinion, it's the best computer screen interface of all the DR equipment I've used. So in summary, the purpose of the capital replacement programme was strategic investment to improve patient care across Powys Teaching Health Board. The scope was to replace the equipment in 5 sites in 2 phases, November 24 and January 25. The key benefits are efficiency. Image processing is 150 times faster, and the patient capacity has the potential to be doubled with waiting times reduced. Image quality has enhanced with low-dose imaging and advanced software. The new equipment is compatible with AI and has improved diagnostic confidence and consistency. In terms of patient experience, it's described as efficient, clean, quick, modern and professional. And in terms of staff experience, it's reduced physical strain and improved workflow and has a positive impact on morale, recruitment and retention. So overall, the outcome was completed. The project was completed on time with significant improvements in service delivery and satisfaction. Thank you for listening, everyone. Diolch. I'm happy to take any questions.
Michelle, thank you so much. That was a whistle-stop tour through a very, very major piece of work. And, you know, I had the pleasure some weeks ago of coming up to Welshpool, and you very kindly gave me some of your time, and it was soon after the equipment had been installed in Welshpool. And I certainly came away with a sense of, well, the enthusiasm from you and your team was palpable, and also picking up. You talk about staff experience, picking up comments from your colleagues about how this new equipment, this new way of working, had made them feel more valued, and also had physically helped the way in which they work and so on. So I came away really encouraged. And of course, Kirsty and her conversations with patients as well, picking up that patient experience. So it is very encouraging, and there is nothing more enthusing than enthusiasm. So that's really good to note.
Thank you.
Michelle, we don't normally open this bit of the meeting for discussion, so it's about, if you like, humanizing and making real some of the things that we read about in papers and some of the data that we receive. But I will ask Claire just to come in and offer any final comments, if you'd like to, Claire, and then we'll move on our agenda. Thank you.
Thank you, Chair. Yeah, just one comment. Thank you, Michelle, for that. That really brought to light the experience that the team have had and the benefits for both patients and our staff, which is really important. I think the other thing to mention is this is only the beginning of the journey we're going on in radiography at the moment. So this was just the kit, the hardware as we call it, that we're replacing. There's currently another project ongoing at the moment, which is to replace all our software. So we will be having modernized software as well, which will allow us to share images more widely with our colleagues in other health boards for radiographers, radiologists and doctors to be able to diagnose more quickly, and other amazing improvements. So we are working on that, and we will update you when that's in place, but that will be over the next year. We will be doing that piece of work.
Thank you, Claire. And as you said, Michelle, I think at its next meeting, the Charitable Funds Committee is going to consider the application for the AI package, and so it's all good stuff, and onwards and upwards.
Absolutely.
But for today, thank you so much. Much
you.
appreciated.
Thank you.
So we move on and we turn our attention to item 1.5 on our agenda. But as I said earlier, we invite members of the public to submit questions for our consideration and for our response. We haven't received any questions for this meeting, and therefore there is nothing that requires our attention under 1.5. So we turn to 1.6, the update reports. Initially, my update report, I will take it as read. And so very happy to enter into conversation or answer questions about any aspect of the report. There are just one or two additional comments that I might make, and that is that very recently, in fact, just over the last couple of days, the recruitment of the to the independent member role on our board is now live. So that is actively out there, and we are encouraging everyone to disseminate that that information as widely as possible. And we certainly look forward to a new colleague being appointed in the very near future. Also, I think it's probably right and appropriate to mention that I have recently undergone my own appraisal with the Cabinet Secretary, and the Cabinet Secretary has set my objectives for the coming year, and I will be reflecting those objectives in the objectives that I agree with independent member colleagues, and also in the objectives that I agree with our Chief Executive. And so that part of the accountability arrangements has also taken place. And so just with those couple of additional comments, would anyone like to ask a question or make a comment? I should also explain to colleagues, if you haven't picked up the message, the platform, the digital platform that we're using was updated yesterday, and so the digital raised hand feature isn't working. So we have, as you know, a separate chat facility. And so if you do want to ask a question or contribute to any of the discussion in our meeting today, then would you please indicate in the chat facility so that I know to bring you in? And I can see, I think, Robert, do you want to come in?
Yes, please. Yes.
Please do.
Robert Lewis, independent member. Just a quick comment, Carl, on the ministerial advisory group, the MAG group, and what they've reported there. I think many people looking at those bullet points will have questions. You know, what does unwarranted variation mean, and between whom? What does reduction in bureaucracy mean? And also, what does aligning financial flows with performance priorities mean for this health board, when so much of our commissioned work, of course, is done by other partners? I notice you say that we're considering the implications of these recommendations for our activity and delivery plans, and I just wanted to know what the timescales are for us to be able to more firmly appreciate the consequences for this health board. Thank you.
Thank you, Robert. I might bring in Hayley, or Hayley, one of your colleagues, to respond to Robert in terms of operationally what is happening in response to the report.
Yeah, thank you, Robert, for the question. And both Carl and I attended the launch event only a couple of weeks ago. I think you're right. I think that there is some further work we're undertaking currently at an organisational level around the implications about taking forward the recommendations within the report, nearly 30, as you can see, but a number of them require action at an organisational level, some at a regional level, and quite a few at a national level as well. So we will be bringing back through committee and board an update on the progress and our assessment of the MAG recommendations and how we will take that forward. And we'll make sure that we're clearly articulating those that we need to take forward at a health board level, those that are regional, and those that are in the national space. I also know that we will be part of a reporting mechanism with Welsh Government that will be established fairly soon to actually ensure that those recommendations are taken forward at pace. And you'll see the timeline for a large number of the recommendations, Robert, were within a 3-month timeline, which is a very rapid response required with regard to this. So we are working through it. We have other discussions planned nationally on this as well, and we will bring back our response to that as part of the normal reporting over the next few weeks. What I would say is that in terms of the annual plan items that we're discussing later, we have reviewed a number of the points, and you will see through some of the updates, both with regard to our delivery plan and also some of the financial planning aspects, that we are also having to include some of the responses and the impact of the additional recommendations around the delivery in year as well. So if you could give us a few weeks to do that work, we'll bring it back through the relevant committee and to board to give you assurance on progress.
Thank you. Content, Robert?
Thank you both.
Thank you. I can't see anyone else wanting to comment on my report, and therefore, if not, we will invite Kirsty to offer any additional comments on her report. Thank you, Kirsty.
Good morning, everybody. Bore da pawb. I'm Kirsty Williams, the Vice Chair here at Powys Teaching Health Board. I'll take the paper as read, but very happy to take any questions that colleagues may have this morning.
Thank you, Kirsty. I'll just pause to see if anyone does want to comment or enter into conversation with Kirsty about her report. No one is indicating, so thank you very much for the report, Kirsty. And we move to Hayley and her Chief Executive report. Thank you.
Thank you, thank you. So in relation to my report, take the majority of the report as read because a number of the items are covered later on the agenda. But I did want to just highlight a couple of points. We are still awaiting the judgment from the Judicial Review with regard to the Emergency Medical Retrieval and Transfer Service, and we do hope to receive that by June so that we're able to report on that at the next board meeting. There's a lot of activity taking place across our borders currently, and in particular I wanted to draw the board's attention to the launch of the work that's being undertaken by How of Our Health Board on their clinical services plan, which is due to start later this month with regard to services, particularly for the communities in Powys that are served by Bronglais General Hospital. We will be ensuring that the content of the consultation and the responses from the public in Powys with regard to these changes are brought back and consider our response as well as a board to the proposed changes by Hywel Dda Health Board. And then finally, really delighted that staff have been able to prioritise and take the time to nominate for the Staff Excellence Awards. And it was, I've had an opportunity to read some, not all yet, of those nominations, and really looking forward in June to hearing the announcements around the shortlisted finalists, and that's been really pleasing to read, and I know we'll all enjoy that part of the year in celebrating staff and their success during the year. And I just wanted to draw particular attention and thanks, and really proud of the fact that the Waiting Well service that was established to support people who are waiting for treatment in Powys were recognised in the National Promote, Prevent and Prepare for Planned Care Awards for their work, particularly around how they've been working together to put patients at the heart of this service, and wanted to wish luck as well to the dental team who've been shortlisted in the UK Antibiotic Guardian Awards for their work on improving antimicrobial prescribing in a dental practice. So those were the additional points I wanted to highlight. Thank you, Carl.
Thank you. So once again, colleagues, do indicate if you'd like to raise anything, discuss anything, ask anything in response to the Chief Executive's report. So yes, please, Chris.
Thank you, Chair. Councillor Chris Walsh, Independent Member, Local Authority. I noticed in the report there was an exercise in April regarding partnership working and collaboration regarding exercise Solaris from some of the pandemic issues, and I just wondered whether there'd been any lessons learned coming through from the National COVID inquiry that we can draw upon, because we did have quite a successful response to the COVID, and I just wonder whether there was lessons learned that we can share more widely.
Thanks, Chris. Just, I wonder, Chris, if you lifted that, wonderful. I think that's probably going to improve the sound.
Thank you. No problem.
Hayley.
Yeah, thank you. I will ask Mez to come in, partly because Mez chaired the exercise, if that's okay. Thanks, Mez.
Yeah, diolch Hayley. Manager Bowley, Exec Director of Public Health. So thank you, Chris. Yeah, so we participated as part of an All Wales exercise in Exercise Solaris, and we participated at an LRF sort of level. And the aim of the exercise was to look at sort of pandemic planning in order to inform a bigger exercise that is happening in the autumn. There is a UK-wide exercise in the autumn element, really. And in Powys, I'm delighted to say that Powys sort of partners participated together in sort of one room as part of the exercise, but we participate as a whole in as a region. And the experience of colleagues participating on the day has already informed our plans already that we've refreshed internally in the Health Board, but equally across the region as well. But there are lessons also as part of the exercise at LRF region and on All Wales level, and an exercise report will be written up, and then the plan is to further revise our planning at a regional level in order to inform our next exercise in the autumn.
Thank you.
Thank you. Diolch.
Hayley, do you have anything to add?
Yeah, just one point. Really, thanks for that, Mez. But both Mez and I participated as well in a national review meeting around our COVID response and learning during the COVID pandemic. So there's been national learning identified. So this exercise was more at that regional level, but just to give some reassurance, Chris, that work around lessons learned around our national response has also been undertaken, and we've participated in that work with colleagues across Wales and Welsh Government, including Public Health Wales.
Okay, thank you.
Thank you. So no one else is indicating that they want to come in at this juncture. So thank you, Hayley, for your report. Appreciated. And we turn then to item 1.7 on our agenda, which are the reports from our various committees. And as I often, if not invariably say, because I think it's really important to say, that yes, we have our board meetings such as today, but a huge amount of work takes place in the committees of the board, where the more detailed scrutiny and the more detailed work takes place in relation to those four main purposes of our board that I mentioned right at the beginning. And so these reports are very key sources of assurance to us as a board, and the chairs of the committees, therefore, are very important custodians and communicators of that assurance to us. And so we will work through them one by one, and I'm going to invite initially Steve Elliott, the chair of our Audit and Risk Committee, to present that committee's report. Thank you, Steve.
Thank you, Carl. Yes, Steve Elliott, Independent Member for Finance. As you can see from the report, we had a very full agenda at the last meeting. We received drafts of the accountability report and the financial statements for 24-25, and noted how much work had been done to pull those documents together in such a short period of time after the end of the financial year. We also received the draft Head of Internal Audit opinion, which is in the process of being finalised before the completion of the accounts. We'd spent a bit of time on considering the 24-25 structured assessment piece of work undertaken by Audit Wales, and that report is in our consent agenda this after for the meeting today. And we also had a very helpful update from our counter-fraud services. Finally, we were able to consider the annual report for the committee covering last financial year, and we've considered and slightly revised our terms of reference for the committee. Thank you, Diolch.
Thank you, Steve. Colleagues, would you please come in, please indicate if you'd like to comment on, respond to, or ask a question about the ARAC report. There are none, so we move to the Charitable Funds Committee that I chair. I'll take the report as read. I don't have any additional comments, but I am happy, as always, to take questions or comments. Does anybody want to respond to the Charitable Funds Committee report? No, therefore we go to our Delivery and Performance Committee, chaired by Ronnie Alexander. Ronnie can't be with us today, and we have accepted his apologies for absence. And so, Helen, I think you're going to speak to this in Ronnie's stead.
I will. I'll try to do as good a job as Ronnie would normally do, Carl. Thank you. So a number of items I'll refer to are also on the board agenda today. So I'll draw that out in the report for the Delivery and Performance Committee. So firstly, the organisational status report in the context of our NHS Wales escalation. There's a full report on our board today, and Hayley, our Chief Executive, will be taking us through that a little bit later in the agenda. But DNP did receive a position update on that. Our month 12 financial report for 2024-25, the Q4 annual delivery report for the last financial year, the health and safety annual report also for the last financial year, the terms of reference review for the committee and committee effectiveness are all included on today's board agenda. So I wasn't intending to say anything further on that other than the committee did its job in scrutinising and seeking assurance on those. In terms of the integrated quality and performance report, the committee received the month 11 report and scrutinised that. It's the month 12 report, the end of year report, that's on the agenda for the board today. We also spent some time considering an in-reach fragility paper, and that was particularly in regards to our JAG accreditation linked to endoscopy, and that's an ongoing area that the committee is seeking assurance on closely. So all of that's in the written report, Carl, but I'm happy to take any questions if anybody has any. Thank you.
Thank you, Helen. Just on that, as you said, a number of items that for our consideration today as a board were also scrutinised in detail by the DMP. Are there any issues, are there any matters that the DMP want to bring to our attention that we should consider when we come to those items?
Nothing specific, Carl. There was some in-depth conversations about a number of those. There was one particular item on the Q4 annual delivery report that was drawn out as an action, and Nicola Johnson will pick that up when she introduces that report later and draw that one out specifically. But nothing else to raise to the board's attention.
Okay, thank you. Colleagues, does anybody want to respond to the DMP report? No, so thank you, Helen. We turn now and invite Kirsty to present the report of our Patient Experience, Quality and Safety Committee, so-called PECS. Thank you, Kirsty.
Thank you, Carl, and I'm very pleased to update the board on the latest meeting of the PECS committee, which took place in the wonderful new facilities at Machynlleth Hospital. It was really great to join colleagues and to have the meeting held out and about, and also enabled us to, myself and Jennifer, one of our other independent members, to pay a visit to the ward following the meeting. But to the meat of the meeting itself, you'll see from the papers there are a number of items that we have previously alerted to the board, and I just wanted to give an update on those in particular. Members will be aware that after a period of local escalation, our mental health services were de-escalated in the autumn of last year. We took time in this meeting to hear from our mental health colleagues about how the experience of being in an escalated service has been for them. And given that that was the first service that had utilised our new escalation processes, whether there were any lessons that we could learn in developing that system going forward. So it was a really valuable opportunity to hear from the staff about how that process had been used to effectively drive change and improvement within the service. As colleagues will be aware, that service has now been de-escalated, but that doesn't mean that our interest in making sure that the improvements that have been gained continue to be enjoyed. And we will look once again at post-escalation performance later on this year. Neurodiversity services, of course, have been escalated to level 3 using our internal mechanisms, and we were very pleased to receive a report on the performance of that service. Good progress has been made utilising additional investment from Welsh Government. That has seen the elimination of our internal waiting list, which I'm sure all of us will be very pleased to hear. But at that meeting, we had received a patient story around neurodiversity services, especially for children. And we all recognise that there is still further progress that needs to be made in that service to hold the position that we've managed to get to, but obviously further improvements are needed. The executive have made available some temporary funds to be able to invest in that service. But the committee is very aware that a longer term solution will need to be found. That service remains in escalation, and PACS will continue to continue to monitor performance. But it was really great to have in that meeting the voice of parents describing, not without some frustration, the challenges of the service that they've experienced to date. So it was a timely opportunity to reflect on that in the discussions on ND services. As Helen referred to earlier, the committee obviously pays a great deal of attention to patient experience and people's experience, and this has previously been alerted to the board by the committee. Not that we don't collect this data, we have an awful lot of data. Various teams are doing a really great job in collating patient experience, people's experience, but our use of the Civica system remains limited. We now do have the People Experience Framework published by the Welsh Government. I think it is fair to say that in implementing that framework, there are quite considerable implications for this organisation, which our staff are working through. And obviously, the PECS committee will keep a very clear eye on how we're able to meet the challenge of that framework now that it has been published. And finally, you'll be aware that in the past, the committee has wanted to alert the board around issues related to infection prevention and control, and the need to institute a 2-year improvement plan. I'm absolutely delighted to say that that improvement plan has been delivered, and following assurance from the Director of Nursing and discussions at the Executive Board, we took assurance as a committee that that plan has been implemented and has been effective, and we now believe that this item can be taken off the alert section of our report to the board, and we'd like to take the opportunity to thank all those that have been involved in delivering that improvement plan. I'm very happy to take any questions.
Thank you, Kirsty. I think, clearly when services go into internal escalation, none of us want to be in that space, because it means that there are things to address. But I think it's really encouraging, I think, to receive the assurance from you that those internal escalation mechanisms are having the impact that they are there to have. And certainly, when we come later in our agenda to consider the framework, the quality and performance framework, then again, it will be articulated there in terms of the purpose of this escalation framework. So I think that's it's good to hear that those mechanisms are there and they're working. So thank you for that. Ian, please come in.
Thank you, Chair. Ian Thomas, independent member. Yes, thank you very much for this report. Obviously, we are seeing some positive progress in terms of some of the areas we've had to deal with: mental health, neurodiversity, and issues around Civica. In relation to neurodiversity in particular, I was wondering what further assurance we could give the population of Powys around, the next set of improvements we are likely to see. The patient story was really touching. I was at the last PECS meeting, and I was just wondering whether we could give the public any further assurance on the next steps of positive progress. Thank you.
Kirsty, would you like to respond, or would you like to invite a colleague to respond?
Well, I'm happy to give some initial comments, but perhaps Claire Roach, the Director of Nursing and Families and Children, might also have some comments to make. Ian, you'll be aware that at that meeting, we received assurance that the internal waiting list has now been cleared, yeah, and we're now able to take people in date order from their referral. Yeah. You'll also be aware that one of the issues that the parents talked about in the patient and the people experience story was what they regarded as poor communication. simply sometimes not even knowing if their child was still on the waiting list, where they were on the waiting list. And the reason why we're able to collect that story is that we've now set up 2 groups where parents are helping us co-produce and co-design the service going forward. So much greater people involvement in the development of our services, and are able to inform, influence, but also, provide that reality check for our staff. So a great deal of time has gone into improving communication and being able to be proactive in that communication to parents, letting them know that their referral has been referred, reassuring them from time to time, because the waits are still long, Ian, as you know, that they are on the list. And the approximate time by which they will be seen. So a much better proactive communication between the service and parents. We acknowledge that the waits are still long, and that's why the service is working hard to develop a model that will be able to bring those waits down. What we're also being able to do is ensure that the quality of our referrals are good, and that we are able to make swift decisions if a referral has come in and that's not appropriate for our service, but there are other services that patient, that family, that child would benefit from, and working collaboratively with our colleagues in Powys County Council, especially being able to find other services for individuals if our ND service isn't the pathway that is suitable for them. But I'm sure Claire can give some further detail.
Thank you.
Thanks, Kirsty. You covered an awful lot in there, so thank you ever so much. I think the brief answer I would give, Ian, is that the work that we have been doing to date has been very much focused on improving our operational arrangements and undertaking some transactional actions that have improved our efficiency. And 2 examples of that would be maximising our use of clinic opportunities to see as many children as we possibly can. We have improved our multidisciplinary team arrangements so that we have an MDT assessment that is obviously hugely beneficial in terms of bringing a number of professionals together to undertake that holistic assessment. We've improved our triage and access to the service, and all of those improvements collectively have realised some improvements where we now do not have children waiting for 3 years, and we have minimised that wait to 2 years. I, acknowledge that that is still too long a wait, and we need to continue to make improvements in that. But over a period of 8 months, we actually saw over 500 children that were waiting in the system that all needed to be seen. And effectively, we needed to be able to manage that so that we could improve our whole systems to then be able to see children in a much more timely manner as they are referred into the service. That said, all of those improvements that we have made have been about improving existing systems. The next step now needs to be, how do we actually transform the way in which we provide the appropriate service and the appropriate support for children and families with neurodiversity, bearing in mind that there is a broad spectrum of what those children's needs will be. And we will be working along with other health boards and other local authorities as part of a national programme of transformation. Thank you.
Thank you very much. Thanks.
Thank you very much, Claire, Kirsty. I can't see that there are any other questions. So once again, appreciate very much the PECS report, and we turn our attention to our Planning, Partnerships and Public Health Committee, chaired by Robert. Thank you, Robert.
But just to say, Chair, that I was away, so Simon kindly chaired the 19th of May. Simon, I don't know if you're going to come in to say anything. We will, of course, receive the detailed minutes at the next Health Board.
Thank you. Simon, do you have any additional comments? Please come in if so.
Nothing additional to add, just that as Robert's outlined, the full report will come to the next board.
Okay, thank you. In which case, let's move on and invite Jen to speak to the Workforce and Culture Committee report. Thank you.
Diolch yn fawr Carl, bore da, Jennifer Owen Adams ydw i, Cadeirydd Pwyllgor Pobl a Diwylliant. And you'll see that, or hear possibly, that we've got one of the first updates I want to share with you is the fact that we have changed our name from Workforce and Culture to People and Culture Committee, which is to reflect the nomenclature in the executive. So that's good news. We met a month or so ago as a committee. Just want to alert the board to a couple of things. You have the summary paper there, but alert the board to two things. First of all, want to alert the board to the potential risk of the Regional Investment Fund, given that that funding stream is under review, and that funding stream supports a number of work streams across the board. So we as a Workforce and Culture, People and Culture Committee are keeping a close eye on that. We are next meeting on the 3rd of June. So we look forward to getting an update on that and getting some, hopefully, assurance or certainty about that. Second thing I want to highlight is the committee were really pleased to note the very good work being done right across a number of work streams, again, in terms of making real progress and taking very positive action in relation to workforce performance. We saw a notable shift in some of the data and the criteria, and we were really pleased with that. So we really welcome that. In terms of just other business, we took a deep dive into the NHS survey. We noted that Powys had a response rate this is a survey that goes out to all health boards. Powys had the highest response rate of 30%. That's still 30% is the 70% of our people didn't contribute or didn't respond, but 30% of them did, and that is useful information in and of itself. And we were the highest performing health board in relation to the response rate. So that was good, and we continue to work hard to try and encourage more and more of our people to respond to the NH survey when it does come out. And also we were pleased to note that the majority of scores across the survey reported by our people, they have gone up, they have increased. So that was also really pleasing to see. And a number of those scores, Powys performs higher than the NHS Wales average. So again, really good to see that. So as ever, a really good meeting. We received the Equality and Welsh Language Progress Report. We were pleased with the momentum and the progress being made against our strategic equality plan. And we look forward to meeting again on the 3rd of June. Diolch yn fawr, Carl.
Diolch, Jen. So, colleagues, would anyone like to respond to the People and Culture Committee report? No, so we once again thank Jen and committee colleagues for that. And not least, but finally, we turn to Hayley and the Executive Committee report. Thanks, Hayley.
Yeah, thank you. So at the point this paper was circulated for the board, we had had 6 meetings of the Executive Committee. A number of the items you'll see that we've discussed and considered flow through to committee and board. But I wanted to just highlight perhaps 4 issues for awareness to the board today. The first one being that we received a digital first assurance report, and clearly identified is a risk with regard to the placement of the Welsh Community Care Information System, is known as WCIS. So wanted to highlight that we will be receiving further detailed assurance to Executive Committee and onward to DMP with regard to the plan to address the issues with regard to WCIS. The second issue I wanted to mention, and I'm really grateful to the staff for the way in which they responded during Storm Dara, but just wanted to give some assurance to the board that the team had led an internal debrief on this, and we've identified 15 recommendations to strengthen our approach for any future similar incidences. So we'll be working through that detail over the next few months. The third issue I wanted to reference, you can see there's reference to a paper being received around the progress around the overseas nursing programme. This has been a really successful programme for us in Powys and hugely helpful to address the staffing challenges that we are experiencing, particularly with regard to registered nursing, general nursing, but also registered mental nurses as well. So there is something really important to note for the board, that the programme is very well received, very well managed, but there is a particular risk that we're facing in the county of Powys with regard to being able to identify appropriate accommodation for nurses, and that's partly due to the commercial housing challenges that we have in a rural county like Powys. The team have tirelessly worked on this and have been very creative around how we've been doing the work to date, but that continues to be an area of substantial energy and focus and concern in terms of the accommodation requirements, both in terms of interim arrangements and the ability of our staff and families being able to then find appropriate and affordable housing after that interim accommodation is provided. And the final point I wanted to raise, you'll see in the report that we had received a case to address the capacity issues within the Mental Capacity Act and Deprivation of Liberty Safeguards team as a result of the limited assurance rating that we received from internal audit. We have had another meeting of the executive committee last week, which is not contained within this report, and I just wanted to give assurance to the board that that case was approved last week, and therefore we're moving forward to addressing the issues and to update the board that that decision has now been taken. So other than that, I wasn't planning to highlight any other issues. Thank you.
Thank you, Hayley. Colleagues, please come in if you have any response to or Hayley's executive committee report or question that you would like to pose. There aren't any, so thank you very much, Hayley, much appreciated. Felly, fe symudwn ni ymlaen rwan at eitem 2 ar ein agenda, sef yr agenda gyd-syniad nes I gyfeirio ato fo gynnau. I mentioned earlier our consent agenda business, so this is now the opportunity whereby any member of the board can request that any item on our consent agenda be taken from that section of our agenda and placed as a substantive item for consideration and discussion. Does anybody want to come in to make such a suggestion? No, so the consent agenda stands and we will deal with it in due course. We turn our attention to item 3 on our agenda, items for approval, ratification and/or decision. And just by way of explanation, we have moved item 4.2 of the agenda, the financial performance report, and we will consider that immediately after item 3.1, the annual delivery plan, because actually when we considered this further, we thought that both of these items informed each other and were closely associated, and therefore it made sense to take them together. But we now turn to item 3.1, to the 25-26 annual delivery plan. Nicola will take us through this, our Executive Director for Planning, Performance and Commissioning. And Nicola, I think you're also going to offer an update about the key actions that we agreed back in our March meeting that were part of the plan. But over to you, please.
Diolch, Cadeirydd. Thank you, Chair. So this paper covers the detailed annual delivery plan for 25-26. The annual plan was agreed by the board in March for submission to Welsh Government, and covers the whole breadth of the organisation, laying out the strategic change and improvement actions across all of our business. As a reminder, it responded to the NHS Wales planning framework and NHS Wales performance framework, as well as being the plan that we need to improve, given that we are in level 4 escalation status for strategy, planning and finance. Members will remember also that the plan was themed around risk, recovery and sustainability. In the risk element, planning to maintain our routine monitoring status for all the other domains, including quality and performance. In the recovery space, it responded to our cost drivers and laid out, as the Chair has mentioned, our savings plans, but also a series of critical actions that we would continue to develop to further improve on the financial plan. In the sustainability theme, laying out our extensive transformation portfolio and further work to engage on our community and mental health models. And prioritise the plan with a series of critical actions to address all those areas. As stated in the report, the annual plan was not supported by Welsh Government, and there's been further work to de-risk the financial plan and refine those further options that were put forward in relation to that, and that will be picked up further by in the next report on the financial plan. In response to that letter to that feedback from Welsh Government, it's not intended to change the content of the annual plan itself, but an accountable officer letter was submitted by the Chief Executive on the 12th of May, laying out that further progress in line with the Welsh Government feedback. It remains important to deliver the plan that was submitted to Welsh Government and approved by the board, as described, covers the whole breadth of the organisation's improvement and change agenda, as well as concentrating on those important financial aspects. The delivery plan was included with the document that the board approved. This version is brought forward in line with our usual process to ensure that the executive leads are identified for each area and the assessment of delivery confidence is undertaken as a baseline at the beginning of the year in order to ensure that the board can meet one of its important roles that the Chair has described earlier in the meeting, to monitor delivery of the plan. In line with our usual process, on which we have had good audit assurance, we will be reporting quarterly on the delivery of the plan to the board and its committees, and have a change control process in place if we need to change any aspects of the plan throughout the year, so that we can remain agile and, as I say, continue to develop the plan that we need in order to meet our strategic objectives and the Cabinet set priorities. The majority of the actions in the plan are, as you'd expect at this time of year, with the plan having been approved in March, have been assessed as high or medium confidence, with a small number being assessed as low delivery confidence, largely where they're interdependent on external bodies over which we don't have direct control. Executive leads and their teams are working on assessing those and to improve that confidence, but also we will report on the progress of those with the rest of the plan in those quarterly reports. The report is here for noting and assurance on that process of monitoring and assuring ourselves as a board on the delivery of the annual plan that the board approved in March. Thank you, Chair, and happy to take any comments or questions.
Thank you, Nick. Please indicate, colleagues, if you would like to ask a question, just whilst people are indicating. Hayley, as Chief Executive, I just wondered whether you had an observation in terms of delivery confidence. Absolutely, accept Nicola's comment about the low delivery and the interdependence on things that are not always in our control. But I suppose ideally we would be looking to a plan that fully delivers, wouldn't we?
We would, Carl, and I think that just in relation to this work is being done at the beginning of the financial year, and this described as our initial baseline assessment of delivery confidence at the start of a full year of work that we need to undertake to deliver the whole content of our plan. I think we've been very open around the 8 areas we've identified as low currently, and that gives you a sense of where we as executive team will be prioritising our attention first, which is about how do we move those lower confidence ratings and increase them. Where there are interdependencies with other organisations, we just need to make sure that we do everything within our gift and within our power to resolve and improve that confidence rating. So I'd expect us to be able to report through these mechanisms the update to the delivery confidence based on more detailed work being undertaken. I think the fact that we've received from Welsh Government the correspondence with regard to our plan, and we'll cover the financial issues in the next item, but clearly delivery confidence in the board is about our ability to deliver our own plan as currently stood. And we haven't changed it at this stage. What we've done is focused our attention on being able to articulate the actions we need to take to deliver our current plan. And clearly we knew it was a high risk in some areas, and we had substantial decisions that we took in the March board that we needed to do further detailed discussions with a number of partners in order to improve our delivery confidence. But our task as a board is to continue that relentless focus on improving our low assessed actions to medium and our medium actions to high, so that we can, as we progress through the year, understand if there is a risk around delivery at end of year in terms of the delivery of the plan. And what I would say in the context of the pressures we're facing as a health board, if some of the actions are not going to be able to deliver what we require, then unfortunately we'll be coming back to the board to identify additional actions that we would need to take in its stead. And that's a really important factor as well, particularly bearing in mind that we have responded on the 12th of May to Welsh Government with the latest position, but I'm expecting this to be an ongoing dialogue as we progress, and later I'll be giving an update on where we are with our level 4 escalation status, and particularly the actions we'll be taking as a result of that will need to both inform and help us hopefully to identify any additional actions we need to take as a health board in order to improve our confidence delivery in year. So I hope that's helpful. I think it is the fact that we're at the beginning of this financial year with 8 areas identified, so the vast majority is in the medium to high confidence areas around our delivery plan, but there is still substantial work to be done to address that. Thanks.
Thank you, Hayley. Mick, would you like to come in, please?
Diolch, Chair. Yeah, thank you. I mean, clearly, a huge amount of work has gone into pulling this together, and it's presented in a very logical and structured way, and I think that's a credit to Nicola and the team. I think that the plan on a page is really helpful. It's really good to see the links between actions and high-level priorities, and I really like the logic map. It's really good to see, those priority actions being highlighted, and then the differentiating between the key drivers that sit beneath that. So, I thought it was a really helpful plan. Just 2 questions, if I may. First one, really, I appreciate a huge amount of detail you know, and it's a high-level plan, and the amount of detail you can put in a high-level plan is quite limited. But some of the key deliverables are quite broad statements. So there are timescales, but there's no delivery criteria. There's no metrics. You know, there's nothing to kind of assess impact. And I understand why that's not in this plan, but it does make it difficult to assess when you're scrutinising the plan whether it's actually been delivered or not, and what the impact of that has been. So I'm just really looking for some assurance that, you know, beneath this are further detailed plans, you know, that provide that level of granularity, so that as a board, you know, if we needed to, we could drill down to reassure ourselves that the plans have some substance, and you know, to be able to know when they've actually been delivered. So that was just the first question. Second one, at the last board meeting, we received an update on the outturn for 24-25, and if I remember correctly, in very round figures, around about a quarter of the actions have been deferred, or there was some slippage. And I think we took assurance that was a reasonable position. So I just wondered whether those actions have been carried forward into this plan. And I think the item we have later, where we talk about the kind of latest update on the plan, I think that alludes to the fact. But I'm just wondering if all those actions have been carried forward in their entirety, or whether, you know, some have been weeded out and not been taken forward. I just, in presentational terms, I wondered whether it would be helpful, you know, in future plans to highlight those things that have carried forward, just to make sure that we're not getting slippage on top of slippage, that things have already, you know, kind of been deferred and not being deferred again. So just those two questions. One about, you know, the some reassurance that beneath this there are more detailed, more granular plans that provide that kind of ability to impact, to assess impact and delivery. And then the other one around, you know, the presentation of carry forward actions, and how we monitor those to make sure they don't slip further.
Nicola.
Thanks, thanks, Mick. Thanks for the feedback to the team, which I will give to the team, and as you say, credit to all teams across the organisation as well as mine in the way that this is laid out and was developed. Yes, the planning team works with all directorates across the health board in sort of developing the directorate work plans. And when we come to the IQPF, obviously those are monitored as well through what's called in that the integrated quality and performance groups. In the schedule, it's in the IQPF, so the two things do line up. And particularly we get into that granularity at that level, so that and build up that bank of evidence as we go through the year, which plays into these quarterly reports. So obviously the planning and performance frameworks are two halves of the same cycle, if you like. So yes, thank you for that question. We do that. I think your point on the learning from the report that we'll look at later on the delivery of last year's plan. We did reflect on that, and we do take that as part of our learning into our planning, as we did for last year, which played into the development of the annual plan for 25-26. I think your point on actions being carried forward, I agree with you. I don't like slippage on slippage, and I don't like rolling actions that may roll forward several years. I've worked for other organisations where we've got ourselves into a bit of a pickle with that, and we haven't carried forward all of those actions. Quite a few of them we have, but they've been adapted to suit where we are now, but not all of them. And I take your point, you know, because they may not meet our needs for this plan and in second year of that 5-year plan, which the board agreed last year. So I think your point on highlighting that and tracking that for the board and having a method of doing that in future plans, we'll take that on board and we'll do that. Thank you.
Content, Mick?
Yes, thanks. Yeah, thanks, Nick.
Thank you. So just for clarity, I think if we can capture that as an action, therefore, from our discussions today, that would be helpful. Steve, please come in.
Thank you, and yeah, I'd just like to echo Mick's comments in regard to the quality of the document and how helpful and useful that is. A couple of questions from me. Firstly, I hear what you say, Hayley and Nicola, about areas of low delivery confidence and the actions being taken. I just wonder if you could say a little bit more around the mental health transformation program critical action, because quite a few of the deliverables in that area do have low delivery confidence, and I'd just be interested to see what's actions being taken to mitigate those risks. And then a more specific point is on under Workforce Futures, Action 12.3, which is about increased recruitment to the bank. I think this is currently showing as action for Q4, but given the importance of trying to reduce our agency spend, I'm just wondering why that's been delayed until the end of the year. Thank you.
Thank you, Chair. On mental health transformation, I think board members will be aware that we were developing at pace our Better Together transformation portfolio at the same time as developing our annual plan. And that was right, and that was exactly what we needed to do. But I think it's fair to say at the point of time of submitting the plan to the board, we were prioritising the Better Together portfolio, really refining what that meant in terms of that chapter approach that we'd be bringing forward to develop what Welsh Government call our clinical services plan, but we call our transformation programme. Mental health we were working on that mental health aspect and prioritising that right up until that point in time. And there has been further work to refine that, which you'll see in the Q1 delivery report when it comes through. But I'll just bring Elaine in now to see if she wants to describe any more of the granularity of that, Steve.
Thanks for that, Nick. I think you've covered that quite nicely. I think the report that we've got in front of us right now was at a point in time where further work to clarify what we need to do to make that mental health transformation programme fit with our wider programme, and to make sure that we are mitigating the risks having come out of the escalation framework was really important. I think we are in a better position now. We've got a clearer line of sight around some of those priorities, and that risk of non-delivery and our confidence has grown. So I would anticipate as we proceed through the year, we will see some change to that low confidence that's reported in this paper.
Thank you, Elaine. I wonder, Deb, if you'd like to comment at all on the bank question from Steve.
Of course. Bore Deborah Wood-Lawson, Exec Director of People and Culture. Thanks, Steve, for picking that up. I think there's a word missing. I think it should be through to Q4. It's an ongoing activity, but thank you for spotting that. Just to reassure you, in the past few months, we've had 79 healthcare support workers join our bank and 98 registered nurses. So it is really important, and clearly it is one of the activities that helps underpin our approach and all of the efforts we're making around reducing variable pay and eliminating agency where possible.
Thank you. Steve, you okay? Anything you want to?
No, that's fine. Thank you.
Okay, thank you. In which case, Jennifer, please.
Diolch, Carl. Again, echo Mick and Steve's comments about the quality of this report, and my compliments and thanks to the team, Nicola. Just two comments really from me. I think they're both questions. First of all, I think you did say this, and Hayley, I think you came in afterwards. I just want to hear again, if possible, please, that this delivery plan, there is an overlap, there is an alignment between this delivery plan and our improvement plan associated with our level 4 escalation status. So they're not the same plans, but there is an overlap and alignment so that one enables the other. So I think you did say that, Nicola, but I would appreciate just you re-emphasizing that, or so that I fully understand that. And secondly, obviously what we've identified was a number of critical actions, and I wonder, please, what is the threshold for what constitutes a critical action, and what's the process for identifying that? Does that come through, obviously, from some of the subcommittee work and the executive work, etc.? So just interested in those two things: alignment with our level 4 escalation status, our improvement plan, and also the process and threshold for what constitutes a critical action. Thank you.
Thanks, Jen. So the annual plan has developed responded to our draft de-escalation criteria that we had with us at that time. There's an item on the agenda on escalation later, setting out that those have now been finalised. I think the finalised ones, there's no surprises in them. If anything, they've become a bit tighter, but there's nothing new in those. So I think we're content that the Honourable Plan responds to those de-escalation criteria. Members may remember that we did a summary of that in the cover paper in March, how the Annual Plan responded to those. In the financial report, we'll talk about the improvement actions, but again, they're well known. The AO letter talks about our further work to refine those. I don't think at the moment we've got new actions that the board isn't aware of that we need to respond to in this annual plan. Clearly, we'll keep all of that under review and report on that in the quarterly reports as we go through the year. If we need to remain agile, as Hayley said, bring forward new things or respond to a change in direction from Welsh Government in year, then obviously we will. But at the moment, I don't think we're thinking that's the case. I think we remain in close alignment. The letter that we've had back confirming the escalation framework confirms Welsh Government's understanding that we've responded to those de-escalation criteria in our annual plan, and the critical actions are key to that. So there's that joint understanding between us and Welsh Government as well on how we've handled that. In terms of critical actions, that was a all executive team discussion using the evidence that we had available. So obviously in the risk element, our risk register as it stood during the development of the plan, and I think our work on strategic risks again in future years will help us with that. In the recovery space, responding to our well-known cost drivers, which again we've been discussing with the board all year, but with Welsh Government as well through the escalation meetings, and in the sustainability space, laying out the plans that we know that we need to become sustainable and to transform. We used a Moscow methodology, if you want to get in the technical side of things, Jen, which is must do, should do, could do, would like to do. So there's an element of judgment in that, but obviously there is evidence that there's a high level of quality of decision making with a multidisciplinary team like the executive team coming together to use a methodology like that to make those judgments. So yes, that's in a way that's the methodology and in effect the threshold that we used to develop those.
You content, Jen?
Yes, very happy with that. Thank you very much, Nicola.
Thank you. Kirsty, please.
Thank you. Nicola, like others, I just want to thank the team for their hard work. Planning guidance, I think, came out very late on Christmas Eve. So it's been, a real challenge. And then not only did we have the initial planning guidance, obviously, since the planning guidance was published, we've had the event at Cardiff, where we heard directly from the Cabinet Secretary around his priorities. And we've had the Ministerial Advisory Group that was referenced early on. And I'm just clarifying in my own mind that you and the team have been able to incorporate those slight differences and those asks that have come out since the planning guidance was issued. And secondly, to note that we have a low level of assurance on trusted assessor. We know that assessment delays is one of the cost drivers for this organisation, and obviously it has a significant impact on patient experience. I think, Chair, when you and I visited the Ready to Go Home ward at Bronchless Hospital, all patients expressed high levels of satisfaction in the care that they were receiving, but the overwhelming message was they would all quite like to go home, and they would have liked to have gone home sooner than they were currently able to do so. And I just wondered, Nicola, given that there is a patient quality and experience issue as well as a financial issue, what more we can do with our partners to achieve what is a long-standing aspiration from the Welsh Government to move to a trusted assessor model that would help us, I think, with our assessment delays.
Thank you, Kirsty. I'll answer the first part and then Elaine will come in on trusted assessor. So thank you for noting that the planning framework came out in December. I think this year we were pleased, although it was a bit later, that we had the allocation letters and the performance framework at the same time. That was actually really helpful for us, as all health boards in terms of our planning. But obviously there's been further refinement of Cabinet Secretary priorities and the MAG base, in alignment with the MAG report in April. As Hayley said earlier, we're doing a full assessment against those things, which we'll bring forward to the board in Q2. And we continue to rely on our plans and most importantly, the delivery of plans, particularly with that high level of Cabinet Secretary priorities. And if that answers your question, I'll hand to Elaine to talk about trusted assessor, if that's okay.
Thank you, Kirsty. It's a really important question, actually, around trusted assessor. What we've seen through the 50-day challenge and the Care Action Committee work is we saw quite a significant improvement in the number of people and the amount of time people were delayed because of assessment during that period of time. I think we reduced by 54%, which is profound. I think, however, it remains a challenge. So we do have a trusted assessor model that's working really effectively in Cottage View. Where we haven't, or at the time of writing this report, didn't have a high level of confidence or a main level of confidence in moving that forward, was we hadn't gone through the process of assessing that. So that piece of work is underway. I think there's a couple of pieces of that. There's our own internal review of what we're doing and how effective that is and how that works effectively, particularly with the local authority. And then there's us assessing where else in Wales has example and learning to share with us and what it is that they're doing. There remains some fundamental challenges around different sovereign organisations and the level of assessment, particularly when it relates to long-term financial consequences for somebody else. But we are working through that, and I would want to see us do what was mentioned earlier. We need to bring our level of confidence from low to medium and then see how we can grow it from there. So we have a plan in place that we are working through, and we would look to review and feed that back through the quarterly reports that we would bring to board.
You content, Kirsty? Would you like to come back? No? Okay. Okay, thank you. So I'll invite Hayley to come back in just to offer a final reflection before we move on then to consider the financial report. Thank you, Hayley.
Thank you. Really helpful comments and questions. And I think a couple of reflections from me. I think that we have to look at a number of things together to get the whole picture. And I think Mick's question at the start around how we're assessing impact, I just wanted to be really clear around the connection between our delivery plan, but also the performance trajectories that we've set as an organisation, that we also submitted to Welsh Government that we have got to deliver in year, which will be very important for us in order to maintain being in routine monitoring on the performance standards that we're expected to deliver. So I think that it was really interesting as well, Jen, around the point that you raised, which is around how are we ensuring there's alignment really between everything. And I think we were able to check that against the draft de-escalation criteria at the time when we did this report. I do think there's more reflection we need on the recommendations that have been recently published by the Ministerial Advisory Group and the recent Cabinet Secretary priorities. And I think that is one assurance we'll need to bring back in the next quarter's report to the board, that we've dealt with that fully. We've done some work on it, but I think there's more to do, particularly, as I said earlier, around the differentiation we need to make between things we need to do as a health board board versus those that we might have a contribution to regionally or nationally. I think the point around the carry forward actions, perhaps we could pick that up in the next report that comes through, just a summary of the position around the carried forward actions, because I don't want things to be lost, but I can't recall it all whilst we were speaking, but I think most of them are either been included or they've been superseded by the context in which we're currently working. And the word that I wanted to bring, and that question around the threshold for critical action, this hasn't been an easy year to set the plan because we have substantial requirements, delivery requirements, both from a financial performance and quality perspective. And I think part of the conversation around the critical actions and the judgment that we made around that, there are some things we just simply can't not get done this year. They have, they really must be delivered. And I think that might change as we go through the year, depending on the context and, the issues we've had to deal with, because a plan is always just set at a point in time, and we never know what's around the corner. But I think that from my point of view, at the time with the information available, I think the judgment on the critical actions are correct. It could well be the case as we're working through the level 4 escalation detailed review work, which I'll cover later, there may be other things that will bubble up to the surface where we will then as a board need to think about whether we need to reset or review some of the criticality of our actions in year. But at this stage, we haven't changed anything in Q1 because we think it's still appropriate that we move forward with those. And I think the other issue, and I know it's difficult, that we may want to think about is where there are interdependencies with other organisations, whether that's national, local or regional. I think we're going to have to clearly articulate that in reporting going forward if there are particular issues that are outside of our ability to influence or control, and be really clear to the board in our reporting in those circumstances. So I think the reflections have been really helpful. Thank you.
Thank you, Hayley. The recommendation against this agenda item is that we note the report. I think we can confidently say we've done that, but that also that we take assurance that this forms the basis of the quarterly review, monitoring and reporting cycle of progress against the plan. So if anyone doesn't support that recommendation, would you please indicate? So that is supported unanimously, which takes us on to what is technically item 4.2 on our agenda, but the financial performance report. And as we see, we're meeting a little bit earlier in the year, so what we have in front of us today is a much shorter and more summary report than we would normally see. But I'll invite Pete, our Executive Director for Finance, Capital and Support Services, and our Deputy Chief Executive to speak to this report. Thank you, Pete.
Yeah, thank you, Carl, and thank you for the introduction and noting that it's a summary report as at month 1, given the timing and the position in the year. So what we do have as well is a slide to share, which hopefully Liz is going to put on screen for me as I start talking. Just to make the point that the report included in the papers references our financial plan starting point, which is the 38.4 million. As the slide comes up, this slide, which I'm hoping everyone can see, just gives you a breakdown and a summary of our original plan starting point, and then those further action areas that the board approved as part of our target for our financial plan. So really, as a summary, as an update, as at month 1, we're reporting an overspend of 3.4 million. That's an overspend against our break-even duty of 3.4 million. The main areas of expenditure and control focus continue to be our English provider activity, our spend on variable pay, our spend in relation to continuing healthcare, and our spend with our mental health private providers. We continue to see system pressure in relation to delays of transfer of care, in relation to social care capacity, and that does impact on our commissioning, variable pay and our continuing healthcare positions. We have identified £9.5 million worth of savings against our £11 million savings target within our plan, which is an encouraging position to be in given the point of the financial year we're at. As reference, we've got further emerging pressures in relation to our mental health provider expenditure, but we have identified mitigating actions to offset that increased cost pressure of £2 million. Against the further action areas that are identified and approved by the board, the current forecast delivery against those areas is 10.1 million. That is summarised in the table on the slide in the top part of that, with further potential improvement actions identified around variable pay and in relation to delayed transfers of care with delivering reduced length of stay. Those actions are currently being finalised and the figures confirmed, but has a potential benefit of 3.7 million. So given those action areas, given the current position and forecast against them, our current forecast position, assuming those actions identified are delivered in full, and noting that the potential risk in those areas is a deficit position of 28.3 million. With those further 3.7 million pounds worth of potential improvement identified, that would take us to a position of 24.6 million. That means there's still there are still further actions needed to reduce that current forecast gap, and it is on all budget holders, all members of the board, to help to identify those further actions to improve the financial position as stated. I think that's the summary for me, Carl, as an overview. Happy to open up for any questions or comments. Thank you.
Thank you, Pete. Colleagues, please indicate if you'd like to respond to the report and indeed to Pete's comments and slides. Steve Elliott, please.
Thank you. Thanks, Pete. Obviously, it's a concern of the level of overspend at this stage. I appreciate it's the very beginning of the financial year and early on, and a lot of the actions are still to be put into place. But 3.4 million overspend in month one is obviously a significant concern given our plan to deliver a 60 million deficit. But that said, I appreciate there's a lot of work going on to identify the work to deliver the actions that we've agreed as a board. In terms of the gap between the forecast currently and our £60 million plan deficit, could you just say a bit more about the process that the executive committee or execs will be undertaking to identify further actions needed to get us down to the 16 million? Thank you.
Yeah, happy to come back on that, and I'm sure exec colleagues Hayley will want to add in and contribute. So given the position we're in, given the financial pressure we're under, it's pretty much a daily task that everyone is tasked with improving their financial position, continually to look to identify further areas where we can reduce our expenditure. Clearly as a first priority, doing that without impacting on our performance and our need to meet those CABSEC priorities as already discussed as part of our plan. So that takes place across all levels, from individual budget holder levels where people are tasked for that improvement, up to more sort of system type opportunities. So there's a full range of actions which are included within our longer term work in relation to Better Together. Is there anything we can pull forward to bring immediate improvement? And it is part of a wider process. So it's multi-layered and all inclusive would be a summary of that, Steve.
Are you content, Steve? I know that Nicola wants to comment as well. Nicola, do you want to comment at this stage, or is it on the same point in response to Steve?
Not quite, Chair. I was going to just come in on the commissioning aspect.
Okay, Steve, is there anything that you want to mention in response to Pete's reply?
Could you just clarify, is it through the executive committee that progress to to identifying those actions will be considered? What's the I appreciate there's a lot of work going on across the organisation, but I just want to clarify exactly how progress towards delivering that is being monitored. Thank you.
That probably links in with a further item on the agenda around our governance approach around our escalation level. Helen may want to comment, but it will be via exec committee, it'll be via the relevant board subcommittee, and then ultimately up to board as part of my monthly financial report.
Okay, thank you.
Thank you. Nicola.
Thank you, Chair. I just wanted to comment on the commissioning aspects around NHS England activity to meet Welsh performance targets. The option that was with the submitted plan was based on technical modelling, and members will remember that was subject to refinement and discussions with providers. Those are ongoing, and that further assessment has been made. But just want to link back to the question Kirsty particularly asked around in the last item. So the Cabinet Secretary priorities in the letter that we had in relation to the plan, one of the things that we were asked to do was make sure that our options aligned to the Cabinet Sec priorities, which were announced on the 7th of April. And there was a slight change there, which may sound subtle, but actually has changed our assessment of that benefit around the commissioning, because the Cabinet Secretary now wants NHS Wales to focus on reducing the volume of people waiting as well as the waiting times. So in doing that modelling, we have aligned to those priorities to reduce the impact on particularly the outpatient activity, but to focus still on the treatments within the measures outlined in the NHS performance framework. That also mitigates some of the risks that providers were talking to us around double running administration costs of monitoring our patients and their English patients, and also mitigates the harm in terms of patients being able to have their outpatient assessment and their care and treatment plan agreed or discharged at that point. So just wanted to note that change here, particularly around those Cabinet Secretary priorities, which were sort of relaunched on the 7th of April, and those further discussions with providers around implementing that option. Thank you, Chair.
Thanks, Nick. Mick, please come in.
Thanks, Chair. I just wanted to echo Steve's concerns about, the early operational overspend. It is a matter of concern. It feels like it could be the start of history repeating itself. Going back to last year's experience. If that continues at that rate, another £3 million overrun to address on top of the balance is quite concerning. But it was just there did seem to be a green shoot, and it was interesting to see that continuing healthcare and funded nursing care was underspent against the profile. I just wondered whether that was a timing issue, or whether that was indicative of maybe a change in the previous upward trend, and whether there might be some green shoots of, kind of progress in some of the work that we've been doing.
So coming back in on that one, yeah, so we have seen some areas of improvement, and Elaine touched on some of those actions that are being taken early on in the board discussion, but there's still some way to go. That 3.4 million I'm referencing is our variance against the break-even target, so that is against a break-even profile. Those areas, it is early in the year, so it's a right comment, but obviously we're focused on all those key areas. That will inform how we update our forecast going forward to understand what that means financially, and also looking to make recurrent any of those actions which are having an impact. So it's something under constant review.
You content, Mick? Would you like to comment further?
No, content. Thanks, Chair.
Okay, Elaine, do you have anything additional to add?
No, I not specifically. What I was going to add was that the comment about continuing healthcare, I think, is probably early in the year to really draw any final conclusions. There is a significant amount of work, and we've wrapped a programme of improvement around a few key particular areas where we've seen significant growth there. So there is an improvement programme. There is significant work, but I think it's too early to draw any initial conclusions at this point. But we will continue to feed that in and work through with colleagues to report that.
Thank you, Elaine. So once again, I'll ask Hayley to come in if you'd like to, Hayley, with any final comments and reflections, and then we'll go to the recommendation. Thank you.
Yeah, thank you. Couple of comments really. In terms of the way in which we're managing this situation, clearly Pete and I meet regularly with all director budget holders, and in terms of the discussion at executive committee, yes, we're having those discussions at every meeting around the current gap, and the current gap as assessed at this month's meeting is 8.6 million, and therefore that is a very substantial gap that we need to understand how those options will be constructed and developed in order to meet the plan that we submitted with those additional actions to get to 16 million. But I just wanted to give assurance to the board that this isn't in isolation, so that will feed through to delivery and performance committee, and will inevitably need to come back to board if indeed there are additional options we have to consider to close further the ability to close the gap. As Nicola just explained, our assumptions around meeting, for example, commission services position has had to be adapted in April, reflecting additional requirements that have come through. So I just want to give some reassurance around how both committee and board will be involved in this work, and the monitoring arrangements that we've got in place with regard to delivery against savings, and the assessment of green amber sort of schemes. And, you know, it is not, we weren't in the position in May of last year, having identified 9.5 million of our 11 million pound savings target. So we are further ahead than we were, but we clearly have a substantial gap as well to manage. The other issue I wanted to mention is, and I will cover it later, but as part of our targeted intervention support, we will be, we have been asked by Welsh Government to procure an external review, and that will stress test as well, both not only our plan, but our arrangements to give an independent assessment, to give assurance to us as a board, but also to identify any other further ways in which we can strengthen our approach to this really challenging financial situation. So I just wanted to bring those two elements, 2 points together at the end, just to give further assurance that we have got a long way to go, but I think that we will need to ensure that you know, we bring back that report, and the decision-making process around some of the options we may need to additionally consider will obviously be board-level decisions. Carl, thank you.
Thanks all, tricky decisions, aren't they, and very important and difficult matters to consider. I think what's come out of our discussion is a shared concern in terms of the financial slippage as to where we are, but equally a shared ownership of that situation. We've received assurance from our executive colleagues as to the ways in which those matters are being addressed at operational level and will be reported to board. And I think we've reminded ourselves as well about of the importance of timely decisions, so that we make whatever decisions are necessary early enough in the financial year in order for them to have the impact that we need them to have. And so that's been a very helpful, I think, discussion that sets both the tone and the content of the forward direction. And so the recommendation is that we note the report, and that we receive the financial report, and that we take assurance that the organisation has effective financial monitoring and reporting mechanisms in place. Would anyone like not to support the recommendation? That too is supported unanimously. And so we're going to have a break now. We're running a little behind schedule, so rather than a 15-minute break, can I suggest that we take just over a 10-minute break and that we reconvene at 11:50, please? Thank you. Croeso nôl, a dyn ni'n pigo I fyny ein agenda unwaith eto. We're going to pick up our agenda again. A very warm welcome back to the meeting. We're having just one or two difficulties, and we're helping our Executive Director for Performance and Planning to rejoin the meeting. So I suggest we go then to item 3.3 and to the report of our Director of Corporate Governance, and I'll invite Helen to speak to this report. Thank you, Helen.
Dill, thank you very much, Carl. So pleased to provide my report to you today. I'll just draw out a summary of a few key points, if I may. So it includes the normal board activity that's been happening since the time the last board met in March. I'll take that as read. The Common Seal has been applied on one occasion. That was in relation to a lease agreement for our hosted body Health and Care Research Wales. Board and committee effectiveness reviews. We're in that time of year. You'll all know there's been some significant contribution through questionnaires and committee conversations. That's been considered across 6 committees, and that's all reported, summarised in my report, but reported in the annual reports of each committee that are included in our consent agenda. We will then be having an overall board development session on board and committee effectiveness on the 5th of June, but important today to confirm that those reviews have been undertaken. We have a consent agenda protocol. Carl, you mentioned earlier in the meeting that we've been running a consent agenda approach now for 12 months. We said that we would review that after a year. We've undertaken a review of that document that you have in front of you, and the Chairs Forum has kindly contributed to that review as well. No significant changes made. There was a real sense that that was working well. We will continue to learn and we'll continue to review and make sure, take your feedback about what's in the consent agenda and what isn't. We apply judgment to every one of those items, but we will continue to learn and reflect on that. So that's presented to you today with a suggestion of a review in a further 2 years' time. And then there is the protocol for in-committee meetings as well presented. This is a new document. As per our standing orders, we've always had the ability to run in-committee meetings for both the board and any of our committees. We keep those to an absolute minimum as a health board. Our approach is one of absolute transparency where that's at all possible. But there are occasions where that isn't appropriate or perhaps items aren't quite ready. We'll continue to keep those to a minimum. As I said, the Nolan principles and transparency particularly will be at the very core of that. And in our minutes, we always now make reference and we include the rationale about why those items have been taken in committee. Again, my thanks to the Chairs Forum. They've reviewed that protocol and that's the copy that's presented to you today. The board annual work programme is also included as per our requirements and our standing orders. That comes to the board at every meeting, but at this time of the year it comes up onto the agenda for you to consider it for the year ahead. It's been designed to comply with our scheme of delegation. It takes into account our corporate and evolving strategic risk register, but also the committee work plans and our working knowledge of the organisation with input from lead executive colleagues and committee chairs as well. As always, the work programme will continue to evolve and change. There's already a couple of items we've identified earlier on in this meeting that we'll be adding to the forthcoming board meetings in the year. So we'll continue to monitor that. The board will receive it at every meeting, so you can also track what's coming on and off the agenda. Carl, that concludes the summary of my written report. I would just like to verbally add, though, if I can, in my last report in March, I gave you an update on the development and creation of our advisory group, the Healthcare Professionals Forum. I indicated to you then that I was hoping to have brought the terms of reference to this meeting of the board in May. My apologies, we haven't quite been able to achieve that. We are progressing. There will be some activity of the Health and Care Professionals Forum within the next quarter's period, and I give you my reassurance that those terms of reference and more significant update will come back to the board in my next report in July. So apologies we haven't quite made those timescales. But Carl, that's the summary of my report. I know there's a couple of other items following in separate reports, but very happy to take any comments or questions on this one. Thank you.
Yeah, thank you, Helen. Just for clarity, are you also inviting questions, if there are any, or comments on the revised terms of reference and the policies and written control documents.
I was going to give you a brief intro to each of those, but if you feel they're self-explanatory, I'm happy to open straight to questions.
As you wish. I mean, if you have any additional comments, then perhaps you'd like to make those now, and then we can invite discussion about the thing in a whole.
Very happy to do that, Carl. Thank you. So terms of reference then, briefly, these have been reviewed as per the requirements of our standing orders. My thanks to all of our chairs of committees, lead executives and committee colleagues. All of these have been considered through the respective committee. So I give you that reassurance that there's been some quite detailed debate in each of those forums. I wanted to just quickly draw out a couple of additional points. I hope the report makes clear to you the couple of areas that we are suggesting transferring between one committee and another. I won't draw those back out unless you have any questions on them. I do just want to draw out some points though relating to delivery and performance committee. We've had quite a significant conversation in that committee, but also in the chairs forum, and we really just wanted to test out that we were ensuring that there was the amount of time available and the amount of scrutiny required, particularly in relation to financial performance. So our audit and risk committee is responsible in the context of financial control. Delivery and performance committee is about financial performance, and as we've heard in the last item, that's a crucial area for the board also. So we considered some different options. We concluded that we should leave financial performance scrutiny within the remit of the delivery and performance committee. We're exploring if those meetings need to be extended to make sure that there is sufficient time for the whole agenda. But one change we would like to make, and my apologies, it's omitted from the report, we would like to rename that committee Finance and Performance to give it that absolute clarity as opposed to Delivery and Performance. So, Carl, that's an addition to just draw out from the paper. Everything else is as set out, and I hope that's clear. And then finally, paper 3.3.2, policies and written control documents. This is a policy retained for board approval as per the scheme of delegation. It's been quite a significant process in the organisation of engagement and consultation with staff and trade union colleagues. I hope the paper is pretty self-explanatory in terms of setting out a revised and quite different approach to how we best and most efficiently develop, monitor, quality assure and publish our policies and written control documents. So that is here for consideration of board approval. There will be compliance that is closely monitored through executive committee as it is now, and that assurance report will also come to the board as well. Thank you, Carl.
Thank you, Helen. So Mick, please come in.
Thanks, Chair. Helen, you've actually answered my question, because I'd picked up that the reference in the earlier in the chair's report about last committee meeting and the board effects review, I hadn't picked up that change of title. But you know, as you answered the question, I just wanted to support it. You know, it struck me from the outset that, you know, the word finance was missing from the committee's title. You know, such a significant focus on it, and particularly with, you know, the current focus on level 4 escalation. I don't think the title actually describes what the committee does, so I would strongly support that as a, you know, if that's helpful.
Thanks, Mick.
Thank you. Steve, please.
Yeah, I was going to say the same thing. I do support the. I think it's right that finance and performance remain under the aegis of one committee, but I do fully support the additional focus through the name of changing it to finance and performance committee. Thanks.
Thank you. And Robert, please.
Yes, thank you, Chair. I'd just like to thank Helen and colleagues for a lot of the work done here. It's quite valuable, I think, as a chair to a committee, and particularly to thank her and colleagues for the work they've done in redefining the work of the committees as well, which is a sort of natural evolution. Just to add on the in committee. The factors needed to be considered when reserving a matter for an in-committee meeting. It is not intended, as we have discussed, that under the category of undermining public confidence, that this should be used as a mechanism to obscure, for example, poor performance. It's not intended for that purpose. It's intended to create a vehicle by which we can scrutinise openly, if you like, and get to the bottom of things. And of course, it doesn't preclude the subject of that in committee eventually surfacing in another form, in a form which is useful to the public and also to other parties. So thank you very much, Helen, for all the work you've done here.
Thank you, Robert. That's a really helpful comment. I agree entirely with everything you've said there. And just to add, one of the things that we'll be monitoring is we already publish our agendas with all titles on. We provide a summary of the minutes also into the public domain of any in-committee meetings. But nearly always in-committee items are also into the public domain in the future. But we will be monitoring that, Carl, just to keep a little check of ourselves, really, to make sure that we've got that check and balance. But a very helpful clarity by Robert. Thank you.
Thank you very much. And just picking up on that last point, Helen, and I don't mean this in an unkind way, but often when people think about corporate governance, they might think about something that's very dry and bureaucratic and so on. You will know that I've just had PADR conversations with all independent members of the board, and I think it's worth just saying that there have been many comments of appreciation of the work of you and your team, both in the way in which you support individual members of the board, but also in the way, as we see in these papers, that you take forward and build on and improve the good governance of our organisation. So I think that's important to mention here. So thank you very much.
Thank you very much.
So, with no further comments, we are asked to approve the management of policies and other written control documents. Please indicate if you don't support the recommendation. Thank you. Now, Helen, I'm going to suggest that we stick with you because we're in a kind of a theme here, and then we'll go back to Nicola for the IQPF. So we're going to turn our attention now to item 3.4 and to the strategic risk and risk appetite statement. Thank you, Helen.
Carl, thank you. And at the risk of being Mrs. Governance, could I just quickly check with you that the board are content with the resolutions in the other papers as well? There were just some approvals in the Director of Corporate Governance paper and just the approval of our terms of reference.
Yes, I mean, is that in the written recommendation, Helen?
It is. Yeah.
All right. Okay, I don't have that in front of me, but okay.
Would you like me to just read those out?
No. I think yeah. No, you're right. I do have it in front of me, and I turned a page too early. So forgive me. That was my mistake. So the recommendation then. Let me correct what I've just said. The recommendation then, in response to Helen's report, is that we receive the Director of Corporate Governance report. We ratify the application of the Common Seal applied on one occasion. We receive assurance that the action was taken in accordance with Section 9 of the Standing Orders. We take assurance that the board and committee effectiveness reviews have been undertaken for 24-25. We approve the consent agenda protocol. We approve the protocol for in-committee meetings, and we approve the board's annual work programme for 25-26, noting it will change according to business need throughout the year. So please indicate if you don't approve those recommendations. Also, as regards committee terms of reference, we're asked to receive the proposed amended terms of reference. We note that all committees have reviewed and endorsed the proposed amendments as referenced above, with the exception of PPPH committee that meets on the 19th of May, and that we approve the proposed revisions to the terms of reference. Once again, I'll pause just in case anyone would like to indicate that they don't approve the recommendation. And finally, as regards the policies and written control documents, that we approve the management of policies and other written control documents. They too. So all of those are approved unanimously. And my apologies for getting my papers mixed up. Sorry, Helen. So let's move on now to strategic risk and appetite statement.
Thank you. Thanks ever so much, Kyle. So you'll record as a board, you approved the revised risk management framework back in March of this year, the last board meeting. One of the significant changes or developments in that framework was the creation of our strategic risk register, a board-owned risk register that directly relates to our strategic objectives, the creation of an organisational risk register replacing the previous corporate one. So what you have in front of you today is a summary of the strategic risk register that's got those draft descriptors in front of you for agreement. If those are agreed today, we will then continue to flesh out those into what you'd recognise as a full risk register in advance of our next meeting. You'll see that there are risks, and just to recognise, we've developed some of this jointly in our board development sessions, so I appreciate there's already been some quite significant board contribution to this. The risks broadly fall into two themes, one that are directly attributed to our strategic objectives, the other theme being those that are more cross-cutting or underpinning of the delivery of our objectives, and they're set out for you in appendices 1 and 2. We've also got a section in the paper in relation to our previous corporate risk register, and very much picking up the theme that we discussed earlier in the board about the tracking of actions or risks and checking that those aren't lost or missed in any way. So what you have in this paper is essentially a recommendation against the previous corporate risks to either de-escalate them to the organisational or directorate risk registers, to update them, or to maintain them onto the revised strategic risk register. And they are set out for your agreement, and we will then transact that into the new arrangements. And then finally, it's the time of year where we review our board risk appetite. This is an important document. It sets out the willingness and the level of risk that we're willing to take as a board in order to achieve our strategic objectives. It is a guide. There isn't an absolute science to risk appetite, as we will know in any way, and it is about helping us take a balanced view across is what often a very complex set of decisions across a number of risk areas and categories. So that's for that reason I say it is an important document, but a guide for us. Again, we've developed that together reviewed that together, sorry, in our board development workshops. Just to highlight though, we had a very helpful conversation about this back in April. There are some areas for you to consider changing the appetite levels. Those are in 3 areas. One is in performance and service sustainability, that we are proposing moves from cautious to open, financial sustainability that moves from open to cautious, and innovation and strategic change that moves from open to eager. And I think, Carl, it will be right to say, as always, risk is a corporate thing, but a personal thing as well in terms of approach to it. So we did have a very helpful conversation where there were also a mix of views and approaches around the board. So what we've tried to do in bringing together the risk appetite is reflect as much of that as we can in a balanced way, but very much welcome any comments or challenges that anybody may have towards that. Thank you. You're just on mute, Carl.
Thank you so much for that, Helen. Colleagues, please indicate if you'd like to come in. Let's go firstly to Steve Elliott.
Yeah, thank you, Helen. I think it's a really good piece of work that's been done here, and really welcome the move to developing a strategic risk register that I think will help us as a board really to focus on our on our key priorities. I think it'll be interesting and challenging for us as a board to consider and develop responses to all of these risks, and I'm thinking particularly about risks around prevention, because that's probably an area that we haven't focused on enough in terms of risk. So I shall look forward to how that's developed and articulated. Just in terms of the risk appetite, if I could just make a reference to the change to the risk appetite for financial sustainability. I suppose my view would be that we need to consider quality in finance in balance, and I quite rightly, we are as a board taken a minimal risk appetite towards quality, and I believe, I think it would be appropriate if we were taking a similar approach towards financial sustainability, because they should really work hand in hand. So that would be a comment from me to move our appetite up to minimal for financial sustainability. Thank you.
Thanks, Stephen. Just before I invite Mick to come in, as you rightly say, Helen, we have looked at this in board development session and so on. We have, and there is always an element of individuality and subjectivity to this. But certainly, as I reflect on the unequivocal requirements placed on the shoulders of myself, of Hayley, and of us collectively as a board in relation to our financial delivery and management, then, and you've heard me say this before, that we do need to hold ourselves quite tightly to those requirements, and therefore Steve's comments about our risk appetite being more in the minimal space rather than in the cautious space is certainly one that resonates with me. But let me bring Mick in, please, Mick.
Thanks, Carl. I obviously wasn't surprised to see it because I was part of the conversation, but when I saw that we'd de-escalated cyber attack from the board's kind of direct oversight, it just felt counterintuitive, particularly given the current profile and the potential impact and the consequences on public confidence. And we're constantly being told it's a matter of if, not when. It just feels counterintuitive to be taking that out of the board's direct oversight. And I had in mind when I was reading the paper that I'd seen somewhere some very, very kind of clear guidance that cybersecurity should be board owned and that it should be led by an nominated independent member. And I couldn't find it, but if you read the internet, the ownership at board level directly of cybersecurity is really a really strong focus, right through the kind of literature. And I just be interested in the rationale for de-escalating it. And I appreciate it's still owned by the executive group. I appreciate it's rolled into a wider risk, but it just feels symbolic of a lesser priority, particularly when we're using the term de-escalate. And it may be just a question that de-escalate is not the right word. We're just repositioning it, or we're providing the oversight in a different way. And it just then led me to a wider question of, have we cross-checked our approach against, all of the good practice guides, all of the kind of audit reviews and the policy directives about where things should be directly owned by boards and where they should be directly owned by a non-independent member. So just two questions, I suppose. Taking cybersecurity out feels a bit counterintuitive, and maybe it's just the word de-escalate, which is not the right word. And that just a wider issue, cross-checking to make sure that we're not going against the grain of what should be directly monitored by independent members.
Helen, do you want to respond to any of those comments and questions so far before we go on to other colleagues?
Yeah, thanks, Carl. I'll just pick up Mick's first, if I may. And I'm just wondering whether or not Kate or Claire may want to comment in relation to Steve's point and your points, particularly around the category around finance and quality. They may not, but they may wish to. And then I'll come back after if that's okay. Mick, thank you for your point and really welcome that challenge. So it's a good phrase. Is de-escalate the right phrase? Maybe that feels a bit harsh. I think my answer was almost in your question in a way, where there will absolutely be a broader strategic risk in relation to digital, of which cyber forms a part of that, and that will sit at board level. That's absolutely right and correct. I think we'd analysed and interpreted it as being cyber being at a more operational level, day to day, dealing with some of those operational things that happen, but not losing it in the strategic context. But I think that's a really, maybe repositioning is a better phrase. It's also worth saying that the board will have full sight of the organisational risk register as well. So it won't be in isolation, it will be together, but with some clarity about roles and levelness, if you like. So I think that's a really important point. We'd envisaged the senior risk owners for the strategic risks being executive colleagues underneath the guidance of the whole board, obviously. For that reason, your point about the roles and responsibilities of independent members, I think, is a really important one. But we'd envisaged, whilst having whole board ownership, the senior risk owner, the accountable officer, if you like, for the delivery of those actions would remain at executive level. Very happy to debate that, but that's in line with the Orange Book, as it were, and the kind of guidance that we get from audit and Treasury. And that's not to say individuals don't have roles in any way. So happy to reflect on your point, but that's my response in the context of the logic of how we'd arrived at the point that we are. So I don't know if that helps, Mick, in any way.
Yeah, thanks, Alan. I entirely understand those, those points you've raised. I suppose what just worries me is that, were we to have a cyber attack tomorrow, and somebody went back to our minutes and saw that we had de-escalated cybersecurity from board levels, strategic oversight, I think that could put us in a difficult position. So maybe it's just about the word, and maybe it's about the dynamics of the process that's beneath it. But it's not a major issue. It just made me feel uneasy when I saw it.
Okay, Carl, perhaps if a solution might be, we need to go away and continue to develop the detail, and the devil's always in the detail, isn't it? And Mez, our Director of Public Health, has raised a really good question in the past weeks as we've been developing this as an executive team as well, around the national risk register in terms of emergency response. And there is a little bit more that we need to pay some attention to there to make sure that we're reflecting the same principle of mixed points. Have we got things at the right level? So that there may be a bit of development that we come back to the board when we've got the detail, that we can reflect on that in the same space as well. So perhaps we can have them as, perhaps they can be the working basis subject to that further detail, if that's comfortable.
Thanks, Helen. That would be helpful, and of course, particularly with the very, very high-profile cybersecurity issues that have hit, big companies and so on, in recent days and weeks. So, I think Mick makes a very pertinent and important point. So, thank you. I'll invite Kate and Claire to come in, please.
Thank you, Carl. So Kate Wright, Medical Director. So thanks very much for the paper. I think it's really, really welcome and useful in terms of just the systems and helping our teams to really clearly understand the mechanisms. Risk is something we deal with all day, every day. Really, really important to understand. The discussion about quality and finance, I find really, really interesting and important. Quality is our key priority, and absolutely our appetite for risk is very, very low there. Having said that, we are constantly balancing. We talk about balancing risks over time, and that's what most of us are doing all day, every day. In my view, then, if we're running a quality service, then that delivers. Quality and finance are linked. A quality service will deliver efficiency. But the flip side is we know that when we're considering our difficult financial position, we have to be really, really careful, and we always do consider any quality impacts. I just wanted to reflect as well that the discussion that has led into this is a really healthy one. The discussion that we all have in terms of understanding our risks, understanding the balance of risks is really, really important. And I think as important as the documents itself and the mechanism itself is the discussion and the understanding that we have that goes behind it. I think that's really, really key. Thanks very much.
Good point. Thank you, Kate. Claire Madsen, please.
Thank you, and thank you for the paper. And I echo Kate's points there. I'm Claire Maslin, Director of AHP's Health Sciences and Digital. So if I come in on the cyber security first, from a digital point of view, I think it's an interesting discussion. We did have a discussion at execs, and Mez did also, Public Health Director, raise this issue. We were thinking of having an overarching public emergency type risk, which could be anything from a power outage to a cyber attack or whatever, and whether we have other things underneath. So I think this is making us all reflect how we cover everything off in a really robust way. So I think we will go away and have a further discussion whether we can have an overarching risk with all of those things sitting underneath, because all would need an emergency response, if you like, in a very big way, or whether we have to separate them out. So I think that's a really helpful question. So thank you for that. And I think the other thing to note from my clinical director point of view is that we all have a duty, we all have a response to the duty of quality, and the duty of quality is the golden thread that goes through everything we do. It's all of our responsibilities, not just the clinical directors. So whilst we are considering these other areas, all of us have a responsibility and a duty to meet that duty of quality. So even though we're separating it, it actually is the golden thread that runs through everything that we do. So just to note that, really.
Thank you, Claire. Now, I can see that Claire Roche also wants to contribute. Ian wants to also come in. I'm a little bit conscious of the time as well. So we will try to bring this agenda item to a close soon, and then we need to go back to our quality and performance framework. But Claire Roche, please.
Thank you, Chair. Claire Roach, Exec Director of Nursing Quality, Women and Family Health. I just want to build on what Claire said in terms of the responsibility of quality as a whole executive team and as a whole board. It absolutely is the thread that runs through all that we should do. And I think, Steve, I really welcome you challenging about whether we should have the same appetite for finance as we do for quality, as they are one side of each coin, as it were. And I think that's really important when we as an organisation need to be cognizant of where organisations previously have fallen foul of that distinction. If we think about the Francis report a number of years ago now, the quality suffered because the focus was relentlessly on finance and performance. And of course, we absolutely need to ensure that we are meeting our financial duties and focusing on how we improve as an organisation as performance, but not considering quality in that we would do as at our peril. So I think having this sort of discussion and ensuring that we are absolutely putting quality at the heart of all our discussions means that we are cognizant of that risk, and that will enable us to ensure that we don't have that risk of where other organisations maybe have had that occur to them, and where we can learn from them. Thank you.
Thank you, Claire. So, Ian, please come in with your comment or question, and then I will invite Hayley to close this discussion, and then we'll move on. Ian, please.
Yeah, thanks, Chair. Ian Thomas, independent member. You'll be pleased to know that my question's actually been covered by Nick, but I will comment to say that risk is a never-ending journey, and and I'm assured by the fact that we do give this the right level of consideration, both within these board meetings and also, in development events. So yeah, that's all I have to say. Thank you.
Thank you, Ian. So Hayley, whether you or whether Helen, I'd be just interested in your view as to how we take this forward, given that, particularly in light of Steve's reflection and my support of that, and, how do we perhaps look again at where financial sustainability risk appetite should be?
Thank you. I mean, this is all a question of discussion and debate, interpretation, and as you said at the start, Helen, different perspectives on this. And my suggestion is listening to the conversation that probably the committee needs to discuss this, particularly the financial sustainability one, again, and go over the loop again. My reflection on that is that I completely see finance and quality going together. But for me, it's about the risk descriptors around the differential between minimal and cautious. We will sometimes have to take a more risky decision, potentially financially, in order to get greater benefit. And so it's just working through some of those issues, but I'm hearing the need for further detailed conversation to land both the financial sustainability sort of appetite categorization, and I think that reflection on the cyber attack, Mick points, I think that would be a helpful reflection as well around the detail, and particularly how the learning, I know we're tied for time, but Mez's assessment around the National Risk Register and how that is all brought together as well. But I think it's excellent work, and it shows the maturity of the board that, you know, we're having these conversations and really reflecting that these are not easy assessments to make. And so, yeah, I'd welcome the opportunity for us to have another loop around the detail before we finalise it for approval.
That's really helpful, Hayley. So, Helen, perhaps we could take that away. I'm sure ARAC will have a role here. Whether it, you know, perhaps it might come back to us in board development or wherever. But as Hayley suggests, we'll just have another look at that.
Yeah, that's absolutely fine, Carl. Thank you so much for the input.
Thank you. Thank you all. So we are asked, therefore, to receive and approve the newly adopted strategic risk descriptors in Appendix 1. We are asked to receive and approve the recommendations regarding the actions to close the previous corporate risk register, taking assurance that the risks contained in the previous risk register will be appropriately managed going forward. And we receive and approve the revised board's risk appetite statement, notwithstanding, of course, the decision that we've just made that we are going to review again, particularly our appetite in relation to financial sustainability, and to look again at where cybersecurity within digital should sit within the register. So with that caveat or with that qualification, does anyone want to not support the recommendation? That too is supported unanimously. So we do now go back to item 3.2, to the Integrated Quality and Performance Framework, and to Nicola. Thank you, Nicola.
Thank you, Chair. So I'm bringing forward the annual update of the Integrated Quality and Performance Framework, following the approval of the current version by the board in March 2024. The framework sets out the system that enables the board to carry out its important role to monitor the delivery of quality and performance in our services across the organisation, in line with the legal and policy requirements of Welsh Government and building on good practice. We are planning, as we've mentioned several times in this board meeting, to maintain our routine monitoring status for quality and performance, and really important that we have that systematic approach, and the board has that good oversight and ability to scrutinise and assure our quality and performance of our services through the board itself and through our committees. In bringing forward this revised